guys, happy Friday. Welcome back to the Q&A. In today's video, I'm going to answer all of your questions about bags under the eyes, under eye bags, what they're caused by, how to get rid of them, or at least how to make them better. So under eye bags are a common cosmetic concern, particularly as we become wiser or older. With age, the supportive framework in our skin begins to decline. The structural components over time begin to lose their integrity, and as a result, the underlying fatty tissue that is underneath that supportive framework starts to bulge out in the areas of the skin under the eyes. The skin there is very thin, and so this is a very pronounced outcome. Additionally, as we age and lose some of that supportive framework, fluid from our body can kind of pool in those areas and result in the appearance of prominent bags under the eyes. There are also a few medical conditions in which under eye bags can suddenly appear or become more noticeable or more of an issue, such as hypothyroidism, as well as a variety of diseases related to the cardiovascular system. So if this is something that is new to you, sudden onset, always worthwhile, of course, to check in with your healthcare provider to make sure that there is no underlying medical condition going on that might cause you to be retaining fluid abnormally around the eyes, resulting in the under eye bags. But by and large, this is a skin change related to aging and something that many people will encounter in their lifetime as they get wiser. It is a cosmetic concern, it is not life-threatening, and in addition to the changes in the underlying structural framework of the skin, there is also a genetic tendency to develop these under eye bags. So you have your parents to thank for that. And there's nothing that can be done to remedy that situation. And then another aspect that I think is important to appreciate is that when you wake up and you have under eye bags under your eyes, or when these become noticeable, they start to cast a shadow under your eye, and that results in the appearance of a dark under eye circle. So you can get saggy bags, as well as dark under eye circles. Outside of age-related changes around the eyes and your genetics, there are a few factors that may be contributing to the appearance of the under eye bags, things that you may not be aware of that you're doing that are making these worse. First and foremost is your sleep. Sleep is imperative to restoring the skin barrier and the health of the skin, and when our sleep quality is compromised, it shows up on our face the following morning. If you're getting 9 hours of sleep out there, you are winning. It is really tough to get 9 hours of sleep, but at least 8 hours, 7 hours, 7 to 9 hours is reasonable and ideal, but not everybody has such an easy time achieving that. But good quality sleep really will pay off dividends on your face. Not only the quality of your sleep, but also your sleep position makes a huge difference, and I personally can speak from personal experience in this as well. It's recommended that you sleep with your head at a little bit of an angle and that you sleep completely flat on your back. This allows for fluid to drain back to your heart and not to collect in those areas under the eyes. If you sleep on your stomach or your side, that fluid's going to pool there and become more noticeable with bags under the eyes when you wake up. So teaching yourself how to sleep on your back and getting better quality sleep will make a huge difference, and also if there's a slight incline. Allergies will also really make under eye bags become more noticeable, similar to how they make dark circles under the eyes become more noticeable. Chronic irritation under the eyes from rubbing, from allergens landing on the thin skin around the eyes, whether it be pollen, ragweed, dander, pet dander, dust mites, that results in inflammation, irritation, and tissue swelling and edema and fluid collection, and more prominent under eye bags. So seasonal allergies are another aspect of under eye bags. Of course, the age-related changes associated with the development of under eye bags are all exacerbated by lifetime cumulative exposure to ultraviolet radiation. So inadequate sun protection around the eyes ultimately can contribute and does contribute to aging of the skin around the eyes and under eye bags. Exposure to ultraviolet radiation from the sun is responsible for skin aging, and that does not exclude around the eyes. And ultraviolet radiation is largely responsible for most of the aging that goes on in our skin and destruction of the supportive framework of the skin. But something else that contributes equally, not only to your skin integrity, but your total body health, is smoking. If you smoke, that definitely will make the under eye bags more of an issue for you. It will destroy that underlying supportive framework in the skin. Tobacco smoke, nicotine, these substances in tobacco, they activate matrix metalloproteinases and elastases, and they result in tissue destruction. Smoking is one of the most poisonous things you can do. So if you're smoking, please try and quit. So hopefully this helps you to understand some of the causes and contributing factors to under eye bags. The way to go about addressing them and to improving the appearance of them is to use simple at-home remedies. You can first just apply a cool compress with a cool damp cloth under the eyes, either right before bed and then maybe again in the morning. Can really help to depuff. Now, if you listen really carefully, you can hear the sound of 1,000 new eye creams coming out on the market. Every second, they're launching, they're dropping the hot new it thing. And they make lots of claims to get rid of under eye bags, dark circles under the eyes. And some of the ingredients in these products actually can be modestly helpful. Things like soy can help brighten up the eye area and strengthen the skin barrier, as well as topical peptides can kind of help hydrate the skin and plump up that skin, the outer layer of the skin, and kind of help to mask some of those dark circles. But really, in terms of getting rid of that fluid under the skin, there's not really an active ingredient that's going to do that. Really, just using a cool compress can be helpful. Managing your seasonal allergies is a key aspect of controlling the swelling under the eyes, the bags under the eyes. Checking in with your healthcare provider before allergy season even starts, making sure that you have whatever allergy medications you might need, can really help set you up for not getting exacerbations of under eye swelling and tissue fluid collection and subsequent dark under eye circles. Anything that you can do to avoid rubbing the eyes is going to help. And a key tip is to never ever go to bed with eye makeup on. Eye makeup, mascara, eyeshadow, all of those little particulates under the eyes, they, when left on the skin for that prolonged period of time, can be very irritating and contribute to dark under eye circles. Not only that, but you know, most people put on their eye cosmetics in the morning and then go and do something. People don't usually put on makeup and then go to bed. And as we go throughout our day, dust, pollen, allergens, things like that, they can stick onto the skin of the eyelids. And so you want to make sure you wash that allergen load off with a gentle cleanser. Another tip as far as your diet is really take a close look at your daily sodium intake and see, are you exceeding the recommended daily allowance of sodium? Most people in America unfortunately do exceed that recommendation, and I think because it's not associated with any kind of acute change that you can perceive, people are like, whatever, I handle sodium just fine. But when in reality, high sodium diets over time, they make it hard on your body to handle fluid shifts, and very slowly your blood pressure can tick up, and it can cause health problems. And one area that can manifest or start to show up is in swelling under the eyes and just collection of fluid under the eyes. You may notice this after you eat sushi out and you have a lot of soy sauce, very high in sodium, that you have more puffiness under the eyes. So just take a very careful, critical look at your sodium intake and try and keep it within the recommended daily allowance. If you can address your sodium, make sure that's dialed in, address your seasonal allergies, and address your sleep. You're doing 3 things that are going to really help your overall body systems function more optimally. And quit smoking. If you are smoking, quit smoking. That will accelerate the appearance of these and exacerbate it. It's really hard to quit smoking though. Comment below, and if you are struggling with smoking, if you're contemplating quitting, I want to encourage you to take that journey. I really do. I know there's probably a good chance that you've tried to quit in the past and failed, but you know, this isn't baseball. There's no 3 strikes and you're out. You can keep trying and trying. So don't accept failure. You can try again. I would encourage you to strongly consider it. So I hope this video was helpful to you guys. If you liked it, give it a thumbs up, share it with your friends, and as always, don't forget, sunscreen and subscribe. I'll talk to you guys tomorrow.